George Kilpatrick Inspiration for the Nation, celebrating people we feel good about. We are pleased to be joined by Tiffany Lloyd. Tiffany is the Director of Women's Health and Empowerment at the Allyn Foundation. She also runs Layla's Got You, and we're looking forward to hearing about both of these things. I met Tiffany. Tiffany Tiffany is one of these people that's in the community, and you turn up, and there she is. That's what she's been doing forever and ever and ever. We used to do tables together. Do you remember that?
I
Back,
do.
and that was a while. I think I was I with Rural Metro at the time? I don't even, but for years,
Yeah, I have no recollection of anything that happened before COVID in terms of time and space,
right.
but it was a long time ago.
Yeah, we did some stuff together, tabling. And you were with whatever was on Slocum Avenue, whatever that was.
For a long time, I was with Syracuse Community Connections, their family planning program.
There you go. See?
Yeah.
And so you've been involved in women's health issues for some time. What is your role at Allyn Foundation, and how do you help women through health and empowerment?
For sure. So I serve as the Director of Women's Health and Empowerment at the Allyn Family Foundation here in Syracuse. And my role is really kind of two-pronged. On the one hand, I'm working with other multi-sector professionals in the community, and we're working together on systems level issues, right? Advocacy issues, figuring out what sort of policy efforts we want to coalesce around, taking a look at the local health landscape, tracking numbers, that sort of thing, being a hub of information, convening people. So it's just a variety of activities that are all kind of geared towards uplifting and supporting local young women by paying attention to the services that are available, the resources, and then the experiences they have when they show up on the doorstep of, local providers, particularly for sexual and reproductive health care, and, ensuring that they have authentic experiences that they are comfortable with and satisfied with.
What are some of the issues that young women in particular are facing?
Well, I mean, I don't think that I have to tell anybody that we have a myriad of issues here in Syracuse, but specifically my work here at the Allyn Foundation really stepped off on a footing around preventing unintended pregnancy. And an unintended pregnancy is just any pregnancy that wasn't planned. And we sort of settled on that as one of our core goals, because we know that when we take a look at our most disparate populations here in Syracuse, and Black women is one of those, especially when we're looking at health disparities, we know that one of the most impactful ways that we can support those women is by helping them to take a really hard look at their reproductive life plan, because we know that for all women, but most certainly this is true, the browner you are, the poorer you are, those decisions you make around sexual health, reproductivity, how many children you have, how closely you have those children together, and then the circumstances within which you bring them forth, they're almost predictive in nature with the trajectory of a young woman's life, especially when we're taking a look at the life force of Black women. So we wanted to do something that would sort of be the rising tide that raised all ships. So I'm in the community, I serve at the foundation as a grant maker, but I'd honestly say that first and foremost, I am a relationship builder. I am doing my best to make my way around the community, connect with women-led organizations, women serving organizations, and Black women-led and serving organizations, and figuring out how do we build capacity for, these folks. In many cases, the folks that are in the trenches doing the work with African-American women and women in general, a lot of these folks are grassroots, right? So they're essentially startups. There's lots of support that they need outside of funding. So I really try to stand in the gap and help to serve those needs.
And so these organizations that come to you, they're non-for-profits, or or mainly, right?
Yeah, they're mostly nonprofits, but I really try to flip it. I try to practice really good funder behavior. I came from the trenches, so coming on board at the Allyn Foundation was really like a total 180 for me. And by nature, I am a people person. I like to try to connect on the level, be authentic, have very authentic relationships, and that's personally and business wise. And so I do my best to go to these local folks first. If I see folks out here doing the good work, they're supporting the populations that we are looking to support or advancing the sort of efforts that we're looking to see move forward, then I try to go find them. I figure out what they need. I volunteer at their event, and then when they do send in proposals asking for funding to support their needs, I thank them for reaching out to us and in many cases allowing us to be their first investor.
So first and foremost, your role at the Allyn Family Foundation is
Heavy on the family.
heavy on the family is to make grants to organizations to help to reduce unintended pregnancies. That's the language that I heard you say, among other things regarding women's health. What are some of the other things, if I got that right, that you are looking to deal with regarding women's health?
Yeah, so that's the core is looking to reduce unintended pregnancies because of what we know happens right in the later years.
Mm-hmm.
However, we understand that it's not just a matter of going out and providing sexual education, because
Mm-hmm.
what we're looking at in many cases is environmental factors as well. What does housing look like for these folks? Do they have access to food? Is there even money to cover the cost or insurance to cover the cost of going to see a medical provider if they need that? And then it's also taking a look at the systems by which we get information, especially our young people. So, I spend a good deal of my time working with the local school district and other organizations that are not necessarily grassroots, larger organizations that are
Mm-hmm.
serving young people and women in our community, and really trying to, craft together the landscape to figure out how folks are doing, how young people are doing, how women are doing by virtue of surveys and other things of that nature. And when we get that feedback, we're able to very clearly see the sort of things that women are dealing with. And what often crops up for local women, especially Black women, is issues around, self-worth and self-esteem,
Mm-hmm.
and the issues that they face in the workplace when it comes to things like imposter syndrome and, whether or not I belong at this table and things of that nature. So instead of going out and just talking about body parts and sex, which there's other places they can get that information. We're in the age of technology, and realistically, Google, right, is a friend and can answer all of those basic medical questions. But we're trying to address the piece related to sisterhood and
Mm-hmm.
fellowship. Like, how are we working together as women? Right. And the traumas related to coming into spaces of love when maybe you haven't necessarily seen that before. And there's just some work that goes into making those spaces work. So we just open the door to create the space for people to come to the table who want to come to a blank space, a blank slate, and create together. In terms of other issues, is the maternal child outcomes that we're seeing in the city. We have really high maternal child harm and death that happens here in Syracuse. I believe that we're higher than a state average and the national average.
Mm.
And so, what that
And I thought we were
screams is
doing
that
better with that. I thought, but in other words, we might be doing better, but we're still higher than average.
we have a
Okay.
long ways to go,
Okay.
most definitely. And
Mhm.
so, we want to see the rise of doulas. We want to see more people that are there to support women.
Is that what your shirt says?
It says Layla.
Oh, Layla. Oh, we're gonna get to Layla in a minute. Okay.
Absolutely. But supporting our local doulas, because they are actually there to provide full spectrum care. Not only are they there through that pregnancy, labor, delivery period, but also, the year in the years following. I had a doula during my pregnancy 7 years ago, and we're still very close. She still checks on me, checks on my son. So we think that's really important.
How important, speaking of, and that's also part of maternal health. And you said that you had a doula and that relationship was important to you. And I suspect you didn't even realize how meaningful it was going to be until you developed that relationship.
Absolutely. I didn't even know what a doula was, if I'm being completely honest. And I had been working in sexual health and reproductive health for over a decade at that point. And now I understand it to be an invaluable addition to, that period in a woman's life. And Keturah, we're still very, very close. And so I want to see more women have access to that. Right now, there's a certified professional midwives bill that is, we're hoping to see that be passed. And what that could effectively do is increase the number of providers that are available
Mm-hmm.
to women like Black women who have, difficult, challenging outcomes when they go in to get medical care, especially around pregnancy and delivery. And it's just an additional set of hands and hearts on the matter to help ensure that those families do okay.
You talk about Tiffany Lloyd with the Allyn Family Foundation, Director of Women's Health and Empowerment. So let's talk about the empowerment piece. How does that show up?
For sure. So the empowerment piece is really my little labor of love. It's called Layla's Got You. We are available. We have a website, www.laylasgotyou.com, and it's the same handle on all social media channels. And this is really our empowerment movement for African American young women that are between the ages of 16 and 25. This is our organizing engine. It is not a program. In fact, our slogan is "It's not an effing program," because we believe that, you know, once young people get to those older teen years, early adult years, they really are not looking for a program. They're looking for meetups. They're looking for things that, you know, involve their passions and the things that they care about, and that's really what we're able to get them to come to the table around. So we open up the door. These young women join forces. We call them ambassadors. And then what happens is we sort of have a reverse strategy whereby we don't really have any program offerings. We come together and organize, and then we go help other grassroots organizations, women serving organizations to meet their needs.
Wow. And so you're not an effing program, right? It's just, that's your thing. And,
Yeah.
and so how many young girls, see, I'm in program mindset, so you got to help a brother out here. So how many girls are in the whatever it is that you do? You just described what you did, but I'm saying, how many girls are in the system of empowerment that you've created, since it ain't a program, and that you said they help support other programs, women serving programs in the community. So can you just explain how that works practically?
Absolutely. So at any given time, we have about 20 to 25 youth ambassadors. Right now,
Youth ambassadors. Okay, yeah.
All of them are in their 20s at this point. We got a couple that are over 25 because they tend to come and not leave. Layla is designed that it's commitment free. So you come when you're able to come, and you serve when you're able to serve. And you're going to have, you know, we're going to expect the highest from you when you're in that space. But when you can't, because life is beaten down, or you have school, or whatever the thing is, it's cool. It's just understood. We'll be here when you get back. So these women come on board, and every quarter we just kind of take a look at the crew we have, and we talk about the things that they are most interested in. And what we see crop up is young women that are interested in things like addressing lead, or young women that are interested in, you know, increasing the quality of education for young people in Syracuse. I mean, it runs the gamut what they are interested in. And then we sort of align their interests with the local needs at the moment. So what this ends up looking like in real time is, last year we spent about 9 months working alongside the Community Foundation, where we were running a participatory budgeting lead project to address the lead issue we have here in Syracuse and increase testing for children ages 0 to 5. Every year we engage in 2 to 3 research projects, and these are national based research projects where folks from other states, you know, they find our published literature online, or they Google search and they find us, and then they reach out because they see that we consistently deliver on having an army of young women at the ready at any given moment. These young women, you know, what you find is most people just want to be listened to. And when you bring them in and you give them a space of love, and then you open up the floor for them to think and to speak and to talk about what's on their hearts, you'll really be blown away by what comes out. So what blossoms from this is we find that these young women have business aspirations. So we end up with an Ashley Homer who starts her own charcuterie business. Or we find that these young women want to be soldiers, so they join the military, and we actually, you know, see them through their basic training process, and then they end up coming back. I mean, there's so many ways in which this blossoms. On the professional side, you know, I specialize in sexual and reproductive health, but really what we're finding is on the Layla side, we're generalists. We go to where the problem is. We go to where people need us, where people will respect our voices. And when we show up in numbers.
Tiffany, you talked about making grants. What's the size of the grants you make to these organizations as part of your role at the Allyn Family Foundation?
Yeah, the grant making is relatively small grants, usually in the neighborhood of $5,000 to $10,000, somewhere in that area. Um, when we're doing this grant making, again, what we're taking a look at is how we're building capacity, how we're taking a look at the local needs, and who's making proposals that actually line up with what people are telling us that they'd like to see, things of that nature.
And how are we doing around? I'm looking at this word, this language you're using, teen unintended pregnancies. How are we doing around that in this area?
Well, on the whole, unintended teen pregnancy on the whole is decreasing nationwide and
Yeah.
here in the state, but even one is too many because we want people to be in full control of their life decisions. I mean, it's really that simple. If we want them to be okay later and, increase the chances of generational wealth for families later, then this is one thing that we really, really have to get under control. And if someone is making decisions around sex that lead to pregnancy and that was a decision they made, then okay, because we're not saying don't have babies, but we are saying take a hard look at the consequences because there's so many examples of how it's a vicious cycle.
And so,
Right now, I
mhm,
was
go
just going
ahead.
to say in Syracuse, we see cases where we see, 3, 4 generations of poverty, and we want to reverse that. Unintended pregnancies, too many babies too quick. Even if you have tons of money, too many babies too quick, it's a financial burden and burdensome in so many other ways. So that is especially true if you're already living on the edge.
It is especially true if you're already living on the edge. And part of that has to do with education. And so, how are we doing in our public schools with sexual and reproductive health in schools? Is that message getting across? Is it difficult? Is it challenging?
Yeah, so here in our local schools, there really are not any mandates around standardized sexual education. I believe there's mandates around HIV. So, I am a sexual health educator by trade, so I would love to see us get standardized sex ed at some point. We don't have it right now. That's for a variety of reasons. However, we have so many health partners here locally that go into schools to provide education, to ensure that these young people have the information that they need, to ensure that their questions are answered, to ensure that they have access to local resources. One thing that I forgot to mention about Layla is that one of the features on our website is that there's a chat bot. Layla is actually a chat bot. People always say, "Are you Layla? Who's Layla?" She's a chat bot. And young people can go there and they can ask questions about sex and relationships, and she will generate, a response, a culturally relevant response at that. So
Uh,
that's a nice addition to the tools that are available for young people.
Tiffany, as you look at the work you've done over the years in the community, what's one thing that you feel the community isn't paying attention to in this area that you would like to see us pay more attention to?
I would like to see us pay more attention to multi-generational conversations. Um, I just don't think we spend enough time talking. Um, Pass the jewels and wisdom, right? Ensuring that everyone within reach in our families has the information they need, medical and otherwise. Um, there's lots of other answers that I could give, but I believe really strongly in the fight and the plight for people who look like me, right? And I understand that nobody else is coming to save us. We have to save ourselves. So I would just love to see more fellowship, people coming together, organizing, using their voices to see the changes that they'd like to see made.
Tiffany Lloyd, Director of Women's Health and Empowerment, and also Layla's Got You at the Allyn Family Foundation. She makes grants for women serving organizations. So, Tiffany, tell people how they can find you.
Absolutely. If folks are looking for me, they can certainly go to our website, www.allynfamilyfoundation.com. In the staff section, all my information is there. You can reach out, send an email. I'd love to hear from local programs that I am not already familiar with. And I plan on being here so folks can reach out.
She got paper
Also,
to get.
send me young women. We're always recruiting at Layla.
Always recruiting. And the young women, again, 16 to 25. And you say that's a wide range, but the older women who are young and just starting out can be mentors to the younger women who are just coming up. I know you liked it I said that, because I'm sure that's how you wanted to go.
But that's exactly how it goes. Women over 30, we call jewels.
There
So
you go.
jewels are, members of our local sororities and other colleagues and friends of Layla that are there to help share wisdom and support our effort.
All right, Tiffany Lloyd, thank you so much.
Yeah,
And
sure.
continue good work. And Tiffany's in the community. You done seen her somewhere doing something, and she's making those connections to help our community get better. Somebody we feel good about here on Inspiration for the Nation. Take care.
All right, you too, G.